Next, we're going to hear from Stonewall Columbus and Karla Rothan, then Join, and then the Columbus Literacy Council. Good evening, Karla.
Good evening. Thank you. Stonewall Columbus serves the Central Ohio lesbian, gay, bisexual, and transgender community by providing a community center and offering programs and services that enhance the well-being and visibility of our diverse community. And the city supports Stonewall Columbus at the community center level. For instance, you support the facility itself, which houses over 50 programs and over 30 organizations that use the center. The different programs, just to give you a snapshot of them, that we have at the center are coming out support programs, gay AA programs, senior programming, youth and family counseling, fitness and health and wellness. We have some special events, and we man or woman an intake and referral desk with volunteers and serve over 10,000 people that call or enter the center every year, looking for help, looking for someone to connect to, an organization to connect to so that they can get more services. Now, it's safe to say that in this economic time that we have, that no city is going through a great boom in financial support for all of social services. But I can be safe to say that in Columbus, we do support the gay and lesbian, bisexual, and transgender community through the city level. And that cannot be said for many cities across the United States. So we do lead in diversity, and it is your leadership, Councilwoman Tavares, but also City Council and many of our city officials that have been able to give us a seat at the table. Believe me, when I was talking to members of my center, members of my community, that were talking about the tax increase and what that goes for, and of course always social services comes up because that is basically what we do at the Center on High. I said to them, we are very lucky to live in Columbus, Ohio, and do not take it for granted, because we have a national organization of GLBT community centers all across the nation, and they are not funded by the city. And so we need to not take this commitment to diversity for granted here in Columbus. And I think it did make some impact, and I think that it is very much supported, and I do appreciate it. Just going back to the center and the importance for recovery, that's really kind of what we do. And sometimes when people are marginalized and they're discriminated against, they don't take very good care of themselves, I'll be honest with you. They have some alcohol, some drug issues. They feel that no one cares about them. Many of them don't have the support of their families, and they don't have a safe place to go, and they don't have a family that can take care of them and help them. And they come to the Center on High, and that's where they find family, support, and connection. And that's why it's so important for us to have that building, that symbol for them, and also a safe place for them to go, a great environment. Some of the things that we've done this year to help us also with our decrease in funding is we've created some partnerships. Maryhaven is one of our great partnerships this year that I'm very proud of. Paul Coleman and I got together and we sought some funding under his work, I should say, to provide a counselor at the Center on High for 10 hours a week, free counseling to so many individuals and families that do not have the health insurance, do not have the money to get counseling, and are desperately in need of help. The suicide rate for our gay, lesbian, bisexual, and transgender community is not decreasing during this time. It is increasing. Our youth are still being bullied in school every single day. I speak to schools on a monthly basis. I go in and talk to kids about their language. I talk to them about how they deal with people that are different from them, and how they deal with gay and lesbian people, transgender people that are in school with them. And you know, it is very difficult out there, and I think there's still a lot of discrimination, and children will come up very secretly after class and say, it's really bad here. It's very bad here. Don't let them fool you. And so a lot of people on the outside, maybe they act like they don't discriminate. They're very cool with it. There are no problems. But internally, there are some very detrimental things happening to our young people, and we need to be able to provide some respite for them. And we have a big intern program. We have kids that are manning the desks. They're actually doing the intake and referral in a sense. We don't do assessments there because we're not really doing counseling, but they'll say, okay, you need a lawyer. I'm going to look in the lavender listings. I'm going to find that lawyer and hook them up. So we have some teenagers that come in and help us. We have hundreds and hundreds of volunteers that man those desks, and they provide hours and hours of service to us, and we're very grateful for it. We only have 2 full-time employees. And we tried to just create better partnerships throughout the city and also open our doors to anyone. You know, we have many people that are taking yoga during the middle of the day, and believe me, they are not gay, lesbian, or bisexual, or transgender. They just probably didn't have yoga at the community center that they were involved in. So we've got some seniors that they really don't care where they do yoga. And so we're very grateful for that. Everything is a very low cost or free. And that is very important because we do serve a lot of low-income families. Just in closing, I just want to say that I love Columbus, and I am so grateful that we were able to pass this tax levy and put money back into this city. It's been a long time, and I know it was very difficult, and I know we had a lot of opposition against it. We didn't pass it by a big margin, but it is going to go right back into helping to make this a safer and better place to live on many levels.
Thank you very much, Karla, and I thank you for sharing how the city's support has helped the residents of our community. And as you said, we are fortunate that we're a community that believes that all of our residents deserve services that are appropriate to the community's members. You talked about partnerships, and I think that's very admirable that you're looking at other ways to connect the residents that come into the center to the services that they need. You talked about the increase in alcohol and substance use within the community, as well as mental health services and counseling services that are needed. But what I'm most intrigued about is the expansion of your health and wellness programs, because again, that's helping the community stay healthy, and it's also helping our community's coffers, because if we have healthy residents, they'll need less services. You know, when people really are into taking care of their body, they use less substances, alcohol and drugs, and they also don't need our health care services as much. So it's a preventative measure for community members to have that health and wellness programming. And it's also, as you said, with some of the seniors coming into the center, it's socialization, it's connecting people so that they have a place to go, mingle with other people, but also get healthy. So we appreciate your sharing that. Any other information around trends that you're seeing that we need to be aware of?
Well, our seniors, this is a very important population, because you can imagine the isolation that seniors face just in mainstream America. But imagine if you are a gay or lesbian person and you go to the senior center in your neighborhood and everybody's talking about their children and their husband who just passed away, maybe if it's a lady, and they don't have anything to talk about. And so they may still go, but they keep a little quiet, or they may not go at all. We also have a lot of seniors, and actually a lot of people in general, who won't go to the doctor because they're afraid to talk to their healthcare professional about their personal life. And this is very, very important, that homophobia is not just from the straight and mainstream America. It's an internal homophobia where we're afraid to get out there and talk about who we are and something that we may need, because we're afraid that someone's going to hurt us. And we still have a lot of violence in the city, and a lot of violence toward gay and lesbian people, and a lot of family violence internally with different siblings hurting people that are gay. So I just want to impress upon you, you know, the world has not changed yet. We're not there yet, and there's still we may have gotten a little bit better, but we haven't. It's not gone. The discrimination in this world. So as long as there is that, we have to be around to help those people.
Very good. Thank you very much, Karla. And could you give me a phone number and website for people who may want to volunteer? And you said you have an intern program where many volunteers are helping to connect people to the service providers out there. If the center can't provide the services, or connecting them to other services.
Yes, and please call 614-299-7764 or go to stonewallcolumbus.org. All one word. Thank you.
Thank you very much for the work that you're doing, and that of the staff and the volunteers. And we hope that people will make their contributions and donations of time and resources, again, to the members of our community who need the services.
And I know it's been a long year, but thank you very much for everything you've done.
You're quite welcome. And next we're